Good day, I'm Dr. K Gireesh, physician, neurophysician, and neurosurgeon. This is the RNA series 32. Now, RNA means Random Questions in Neurology and Neurosurgery with Answers by Dr. K Gireesh. This is to benefit the practitioners of neuroscience and the medical field at large for a lifelong learning and also for public awareness. Now, in this series, the question that I'm going to answer, what are the features of diffuse axonal injury? Diffuse axonal injury is a form of traumatic brain injury that occurs when rotational or shearing forces cause widespread damage to the axons in the brain. It is a common cause of persistent vegetative state and severe neurological impairment after trauma. The features of diffuse axonal injury. What is the mechanism? This results from the shearing forces caused by the rapid acceleration, deceleration, or the rotational trauma, especially in high-speed motor vehicles, accidents, falls, or assault. The forces disrupt the structural integrity of the axons, leading to the axonal stretching, swelling, and eventual disconnection. Axonal shearing is the mechanical stretching damages the microtubules and neurofilaments within the axons, impairing the transport mechanism. Biochemical cascades lead to calcium influx, mitochondrial dysfunction, and axonal disconnection. In the histopathology, there is evidence of axonal retraction balls, which are swollen, severed axons, called as spheroids. If you look into the biochemical changes in diffuse axonal injury, within 1 hour, the neurofilament immunoreactivity occurs. 4 to 5 hours, accumulation of the amyloid precursor protein occurs. 6 hours, ubiquitin, a marker of neural damage, is evident. 12 to 24 hours, axonal varicosities. 2 months to years, you get the Wallerian degeneration and demyelination. Anatomical locations, you do find typically it affects areas where the tissue densities differ, making axons more susceptible to the shearing forces. Gray-white matter junction in the cerebral hemispheres, the corpus callosum, the brainstem, the cerebellar peduncles. These are the areas which get affected. You get the clinical features are a loss of consciousness immediately after the trauma, often prolonged, may result in a coma without significant intracranial pressure elevation. Persistent vegetative state or severe cognitive and physical impairments. Focal deficits are less common as injury is diffuse. In mild cases, a concussion-like symptom. Example, headache, confusion, dizziness, and in severe cases, profound loss of higher cortical functions and motor impairment occurs. The radiological features, CT scan, may appear normal or small petechial hemorrhages are seen. MRI, T2 weighted imaging, you find, or susceptibility weighting imaging, micro hemorrhages will be seen. In DTI, diffusion tensor imaging, detects subtle white matter disruptions. Now, the grades of DAI. Grade 1 involves the gray-white matter junction. Grade 2, the corpus callosum gets involved. And grade 3 extends to the brainstem. That is 1, 2, and 3. The management is in acute phase. The focus on managing the intracranial pressure, oxygenation, and hemodynamic stability. Avoid secondary injury like hypoxia or hypotension. And in the long term, rehabilitation for the physical, cognitive, and emotional impairments. The prognosis is variable depending upon the severity and extent of the axonal injury. Severe DIA often leads to significant disability or a vegetative state. What are the key points of diffuse axonal injury? Diffuse axonal injury is often underdiagnosed, but is a major contributor to the morbidity and mortality in traumatic brain injury. Imaging, particularly MRI, is essential for the diagnosis, as CT scans may miss subtle findings. The severity of the clinical presentation correlates with the extent and the anatomical location of the axonal damage. That's in brief the answer for what are the features of diffuse axonal injury. Thank you very much.